Well, my name is Robin Mantooth, and I'm a physician. I'm an emergency physician. Now I'm the chairman of the emergency department, and then we train residents as well. And about 6 years ago or so, I developed some unknown, I believe, an autoimmune disease where I had very strange symptoms. My main symptoms were muscle stiffness, where when it was active, I literally could not bend my leg because it would stretch my muscles in my thigh, and I couldn't bend my legs. But it would sometimes go up to my neck and my shoulders as well. I went to a neuromuscular specialist. I went to a rheumatologist. I went to an orthopedic doctor. Went to a neurologist. So I went to multiple specialists here, and then I worked with the people at Johns Hopkins, and then I went to Mayo, and just never really got a diagnosis. And I thought they probably think I am making this up. And so that was a little bit difficult to get past as well, because I wanted to let people know, no, I actually have symptoms, but my labs, I had CAT scans, MRIs, I had PET scans, I had every scan imaginable. Everything is normal.
And I remember you telling me that you literally, at that point that I first met you, you couldn't walk without taking steroids.
Yes. So I myself started on steroids. I would make sure in my carry-on bag, in my husband's carry-on bag, in our check-in bag, in my desk at work, in my car, I had prednisone, because without prednisone, I felt that it was just pure misery. So I had a colleague at work, and she said, hey, you should look up this doctor. She's got this book, and she's telling me about Goodbye Lupus and your name. And so I wrote it down on a little sticky pad, and I started looking you up, and I bought the book off of Amazon, which was, the first of probably 30 books I bought off of Amazon to give to people. But I bought the book. I started reading it that day. I told my husband, okay, we need to get some kale. And that started him on his daily go to the grocery store, get kale trips. I started doing that. And within 1 week of starting that, I was able to lower my steroids by 1 milligram. But before, whenever I would try to stop my steroids, I would go down by 1 milligram, and I would have to double it, because it was full blown, just like I wasn't on any medications. I was stiff and sore, and it was terribly painful. So I started going down immediately off the steroids and have no symptoms. Like, I feel completely cured. I really do want to thank you for your work and for the help that you gave me. And I know you're giving many other people, but without this, I would still be on steroids, and my bones would still be becoming more and more invisible. I mean, that's just a fact. That's just truth. And so I really appreciate it. I thank you for your work and your desire to share this.